Hey Cam followers, it is episode number 5 and we are still on this lovely diagram that you can see here, and we're the third cube in from the left, and this is managing expectations. What is this about? This doesn't have anything to do with arthritis. Yes, it does. Arthritis is not curative. It's a progressive disease. Unfortunately, we still don't have any way to completely halt the disease. The only true hope of curing arthritis is to remove the joint with a complete joint replacement, which isn't possible with many of the joints that are afflicted with arthritis. So arthritis is a chronic, progressive condition, and I'm sad to say is a leading cause of premature euthanasia. If we don't manage this disease actively and effectively, it will progress at sometimes quite a fast rate, and it will lead to your dog suffering, being unable to move comfortably, choosing not to move, and then getting to the point that it cannot move, and that then leads to euthanasia. So we need to be managing your expectations because it's a long-term, chronic, progressive disease. So what sort of things do you think you can leave the CAM followers with regards to their expectations having had a diagnosis? And let's use a case example. Let's go straight for the throat. Let's go 8-month-old golden retriever, hip dysplasia.
So they've come to me having just been given a diagnosis of the hip dysplasia. I think I always try to find out what an owner's expectations is right at the beginning.
Yeah.
If they want their dog to go on and do agility, for example, or if they just want them to be a family pet who can do long walks with them until they get a bit older, and then they realise they might have to cut down the exercise a bit.
Yeah.
So we'll look a lot at, I will definitely engage my physiotherapists in the conversation because it's going to be a lot about
management,
education and of the owner, and managing the condition, ongoing sort of exercises to do, doggy Pilates, and also explaining that we might need medication either now or at some point in the future to manage it.
Yeah. And it's a lifelong disease. So that dog at 8 months,
that's the best time to find out about it.
It is,
because you can stop the long-term changes, like muscle loss and things, from an early stage.
You've got the best chance of managing it, but that is dare I say, a daily consideration for the rest of that dog's life. And when I mean a daily consideration, I would, as your supportive vet, be saying, minimise the amount of impact forces that dog does. You know, look at going on walks that are not going to push that dog over the edge. Think about the impact of that dog with those, slightly lax, slightly painful hips, jumping in and out of a river 20 times, which it hasn't done that for the rest of the week. I would want my owner at that point to go, I need to be aware about how much and what my dog does. I'd be talking to them about strict weight control for the rest of life. I'd be talking to them about introducing a supplement early in the life stage. I'd be saying to them, I'm going to be seeing you every 3 months. This is a disease that we need to keep an eye on. This might mean that I have to image your dog, x-ray image your dog 2-3 times in its lifetime potentially. I will be throwing you ideas of interventions that are coming into play. So it's really exciting in the arthritis world now. We have new things coming into play all the time, such as stem cell therapy, which we'll talk about in another episode. So that owner with that dog who's only recently purchased it has got to accept that this is a condition for life that is going to be physically, emotionally and financially affecting their life together. Yeah? Okay, let's deal with the expectations of the 10-year-old Labrador that walks in like a broken, disabled spider.
Interesting description.
Well, they do, don't they?
Yeah, so I think again, I want to know what the owner is thinking right from the beginning. A lot of people, there'll be some grief there already, some elements of, I'm not going to get my dog back. I'm not going to get my physically fit, highly active dog back. So, but I like to talk about the fact that with appropriate therapy, and this is not just medications by any stretch of the imagination, not just medicines, with appropriate adjustments, therapy, looking at the household environment, things like that. And a lot of this is homework, things that the owner needs to do.
Yeah.
That you can certainly get a better quality of life for your dog going into his old age, so that he is only, so he's minimally limited by his disease.
Yeah. Totally agree. I worked with a lovely lady who, when she does her questionnaire before starting a dog on our hydrotherapy plan, right at the end, in a really quite a profound way, she says, so what are your expectations? And she finds that really gives her an opportunity to tell the owner that's too much, you're expecting the impossible. Or yes, that's totally the goal that we're aiming for. So she might have a young working spaniel come in who has got bilateral elbow dysplasia, but the owner wants that dog to remain working, and that dog is physically fit, pain is minimal, it's got good muscle mass, and she can say, well, yeah, I think that's potentially possible, but what we need to do is keep your dog fit, keep your dog comfortable, and keep reassessing it. But she might also have, arriving at a hydrotherapy pool, a 12-year-old seriously overweight dog with very minimal muscle mass that's also hypothyroid, has got arthritis in every single joint, and that owner wants to go back to hiking. And at that point she can say, that's not going to happen. This dog, to have a good quality of life, and for us to manage this dog's pain and get them to live a comfortable life as long as possible, please let's look at your expectation and deal with it now. This dog's going to be more of a routine dog, park-based, easy terrain, shorter walks. Let's set your expectations realistically.
But there's also the reverse aspect of expectations. So I think a lot of people will come in expecting a quick fix, that their vet's going to just be able to give them a magic pill to sort the dog's pain out. And then when you realise that you've got to do quite a few adjustments for your dog, you might be given, if you've seen a physiotherapist, you might be given some exercises to do with your dog at home.
Yeah.
And that
takes
takes
daily
time.
investment.
Time sacrifice, financial sacrifice, and also your own. There's a lot of talk in the profession at the moment about the mental health of own caregivers, the caregiver burden.
Yeah.
So there's even that aspect that you need to consider. We're not necessarily going to just be able to give your dog a magic pill, make him better.
And I think that's what drives most of the team to support CAM. So we have hydrotherapists, physiotherapists, laser therapists, nurses, specialists, vets. We have a lot of people working together to create this content. And the reason they do it is because they've all suffered caregiver burden. And what that basically means is they've been through what it feels like to look after these dogs from the beginning to the end. And that might be for some people a year. For other people it might be 10.5 years, we don't know. So it is very, very hard work for owners. And that's the reason that this episode, however fluffy it might seem to you, we're trying to prep you for managing your dog's disease long term. There isn't a quick fix, there is no cure. Even joint replacements doesn't mean that the dog hasn't got it elsewhere and hasn't had other changes take place, but we will talk to you about that later. This is something that sadly the profession, be it medical or veterinary, we still haven't got the answer. So what we need you to do is understand that you're in this for the long haul, and that means that you might have to change your routines, you might have to change your home layouts, you may have to change where you walk, your hobbies, but be prepared. So, any more to add?
I was just going to add, something popped in my head. I have clients who have Dosset boxes for their dogs.
Oh, really?
For all the medications they've had to give.
Really?
Yes, but they still have their dogs 2 or 3 years after the point which their primary vet had said we might need to put him to sleep.
Yeah.
And actually the dog's still got quite a good quality of life, but we've done a combination of treatments.
I went to see a client last night, Buttons Diamond. Hello, Mrs. Diamond, if you ever get to watch this. And Buttons saw me 2015 thinking that we were close to the end, and we're now 2019, and that's because we juggle lifestyle, weight control, different medications, different interventions. It is possible, but they are dedicated owners, aren't they?
Yes, you have to be dedicated.
Cool. Right, so we'll see you for episode number 6, where we're going to start talking to you about how to work with your vet. Again, we need you to understand the rules and regulations around diagnosing, prescribing medications. So we will see you for episode 6. See See you later.